All right, folks, thank you very much for your patience with us just there. My apologies for the delay. It's great to see everyone here today and great to be having workshops back here in person. I'm very excited to introduce Jake today, who's going to be giving our talk on nutrition. I was really excited when Jake contacted me a few months back now with his real passion and enthusiasm to help people and help people gain greater health through nutrition. And I was really blown away by his presentation he put forward to me and how he wanted to help with active seniors. So I'll hand over to Jake now, but please enjoy your time with Jake, and afterwards he will give information if people are looking to book appointments and make a session with him and talk to him further about how he can help with their health. He'll be answering those questions afterwards. We will obviously have a class at 1:30, and I know we started a few minutes late, which is kind of eaten into that time a little bit. So even if we just want to move into the reception area afterwards to have a chat with Jake as we set up for the next class, I do appreciate that. So thank you all very much. Enjoy, and I'll hand over to Jake. Here we go.
Thanks so much, Taylor. Welcome, everyone. So today is the fundamentals of human nutrition and evidence-based nutrition intervention for the senior demographics health challenges.
Excuse me, could you please turn towards us because you're turning towards the wall?
Sure.
I
Got it.
can't really hear you.
Alrighty, cool.
Nice and loud. Yeah.
So my name's Jake. I'm 29 years of age. I graduated last year with high distinction honours in the Bachelor of Health Science, Nutrition, Dietetic Medicine. I've had a little bit of an extensive journey. So this is me on the left, where I was 15 years of age. I got diagnosed with severe anorexia nervosa, where over the age of course of 10 years, I was in and out of hospital. Was very difficult times. And then unfortunately 10 years later, I got a brain tumor where that I had to have radiotherapy treatment for 10 weeks as well afterwards. And that's me now. So fortunately I've recovered from both, but I choose to study nutritional medicine because I wanted to learn how food can be used as medicine for the body. So what am I? I'm a nutritional medicine practitioner, which is just a clinical nutritionist. I'm a nutrition coach, and I'm a corporate nutrition presenter and keynote speaker. What I do is evidence-based individualized nutrition plans. I've underlined the words evidence-based. Evidence-based meaning that I'm not giving my opinion when I'm giving nutrition plans. Everything is based on the literature, books, journals, and articles. And my business is nutrition longevity. I'm trying to do nutritional coaching for life. So, the first thing I wanted to understand from you guys are what are your health goals? So we have some goals here. Weight loss, lose body fat, tone up, increase muscle mass, weight gain, improve sleep, improve energy levels, reduce frequency of colds and flus, reduce cravings, improve cognition and mood, reduce the onset of migraines or headaches, learn about what is healthy eating, improve balance by hormone levels, improve gut health such as bloating, constipation, diarrhea, flatulence, anti-aging or medical management such as high blood pressure, high cholesterol, osteoporosis, arthritis, or diabetes management. Sorry, I don't have your name.
Susan.
Susan, why don't you start with what would be your number one goal?
So osteoporosis.
Osteoporosis. John.
Same with me.
Osteoporosis. Helen.
Toning up.
Toning up.
Gaining weight.
Gaining weight.
Keeping my weight and in condition.
Okay. Jack.
Probably a combination. Losing weight, osteoporosis, keeping it at bay as well. So.
Perfect. Yeah.
Sorry. I would say improve energy levels
Yep.
and healthy eating. Yeah.
Okay.
About just healthy balance,
Balance.
and improving the gut health.
Okay, fantastic.
Losing weight.
Losing weight. Steve.
Diabetes and arthritis.
Diabetes and arthritis.
Energy.
Energy.
Medical management of a few problems.
Okay.
Osteoporosis.
Osteoporosis.
Management.
Osteoporosis. Last one.
All of them.
All of it. Alright, so we're going to a bit of everything. Okay, so what are we going to speak about today? We're going to speak about the fundamentals of human nutrition, macronutrients, micronutrients, common health challenges for the senior demographic. What do I do? My personalized nutrition consultations and a Q&A. So, the first thing we need to understand when we're dealing with human nutrition, we need to understand the base, what we call the ABCs in nutritional medicine. So the ABCs are the fundamentals that we have to get right. The first one is macronutrients. So macronutrients are large nutrients that are required in large quantities for energy and proper daily function. So different macronutrients have different functions, and the human body requires different amounts for optimal health and well-being. There's 5 different macronutrients. Number 1, protein. Number 2, carbohydrates. Number 3, dietary fat. Number 4, dietary fiber, and water. So the first one is protein. So protein actually comes from the Greek word proteus, which is meaning of primary or holding first place. So whenever I'm working with someone, protein is number 1. Why? The key function, so the growth and maintenance of tissues around the body. We need growth, it maintains them, maintains cellular biochemical reactions. So there's a lot of thousands of biochemical reactions going on in the body. We must have proteins to maintain those. So many proteins are actually hormones. So hormones are chemicals, messengers in the body that tell the body to do certain things. We must have proteins for the hormones to work properly. The next one provides structure to bones, ligaments, and joints, maintains pH levels in the blood, maintains fluid balance, and it's also really important for our immunity health, so in order to reduce the frequency of colds and flus, as well as the transportation and storage of nutrients. So this is a very key point with protein. So what that means is that when we eat, we get nutrients, but we have to have protein in order to transport that throughout the body. Otherwise, there isn't that effective transportation. So we look here at some high quality versus low quality proteins. So we've got some high quality proteins, which are lean meats, legumes, poultry, fish, seafood, dairy products, and eggs, versus lower quality, which is processed meats such as salami, corned beef, bacon, sausage, and beef. So we just need to make sure that in our daily diet, we have protein at regular intervals throughout the day, not a bolus amount at one time, but regular intervals throughout the day. The next one is carbohydrates. So carbohydrates is actually the primary fuel source for the brain. So the brain relies on glucose for energy. We must have carbohydrates for the brain to work optimally, as well as the primary fuel source for exercise. So what is some really key functions of carbohydrates is that it helps preserve lean muscle tissue. So we have to have carbohydrates to preserve the muscle tissue. The next thing that is really important is carbohydrates, high quality carbohydrates such as brown rice, whole grain bread, are high in dietary fiber. We'll get to dietary fiber a little bit later. But dietary fiber is critical for digestive health. We absolutely have to have carbohydrates from high quality sources for our digestive health to be on point, which is going to be very, very important for the absorption of the nutrients that we eat. Also really important, there's a lot of studies that have shown that carbohydrates, high quality, being shown very good to be for type 2 diabetes management, because it prolongs our blood sugar levels, so it sort of maintains, the body likes to be what we call in homeostasis. It's also really important for heart health, and it's really important for sleeping better. High quality carbohydrates release the neurotransmitter tryptophan and serotonin. So tryptophan and serotonin are directly involved with sleep quality. So when I'm working with someone who doesn't sleep well, actually what we call carbohydrate backloading. So carbohydrate backload is a term where we utilize having carbohydrates in the night of upregulated serotonin and tryptophan. The key thing with carbohydrates that we need to understand is the low glycemic versus high glycemic. So low glycemic, such as from brown bread, means that when we have carbohydrates, a hormone called insulin goes up. But what we need to make sure is that with the low glycemic sources, because it has a higher dietary fiber amount, it means that our blood sugar levels are stabilized. Versus the high glycemic carbohydrates, which is from sugar, donuts, pastries, that immediately spike our blood glucose levels, and then over time it's just going to go crashing down. But we need to make sure that we have the majority from the high quality carbohydrates, food, brown rice, whole grain bread, whole grain pasta, sweet potato, oats, versus the low quality, the more mainstream white bread, pastries, donuts, and so forth. The next macronutrient, dietary fat. So I put in a key point at the top. Dietary fats have over time got a bad name, but it's absolutely critical for health. We have to make sure that we have our majority of our food intake coming from poly and monounsaturated, which are the more anti-inflammatory fats, versus the saturated fats and the trans fat are more pro-inflammatory. So pro-inflammatory meaning there's a greater onset of disease. So we have to make sure that we have anti-inflammatory foods in our diet. Every day the body accumulates, builds up inflammation. We have to make sure that we have anti-inflammatory foods that bring down that inflammation, such as avocado, nuts, seeds, oily fish, and having a very low amount of, for example, cookies, pastries, and hamburgers. What are the key functions? So dietary fat is a critical energy source, so the body needs dietary fat for energy production. Number two, which is probably the most important in nutritional medicine, it's required for the absorption of fat-soluble vitamins, which are vitamin A, D, E, and K. So when someone goes on a no-fat diet or a very low dietary fat diet, someone cannot absorb the fat-soluble vitamins such as A, D, E, and K. So, for example, vitamin K has been shown to be critical for bone health, particularly from the osteoporosis side of things. Vitamin A, D, and E have been shown to be really important for the metabolism. So metabolism is the rate at which the body burns energy after we eat. So we have to have our metabolism being high for optimal health, and also that's really important for something like weight loss. Next one, supports cellular growth. It also maintains cholesterol blood pressure levels. So it actually, when you have a good dietary fat amount from anti-inflammatory polymono, it's been shown, the literature's been shown that it actually improves cholesterol and blood pressure levels. The next one as well is that we need dietary fat for hormone production. So hormone production, again, like we said before, is really important for the chemical messengers in the body. We have to make sure we have dietary fat in there. Dietary fiber. So dietary fiber is a sort of what we call in the nutrition industry a very missing link macronutrient. The population, the media looks to speak about protein, carbohydrate, fat. But dietary fiber is definitely one that is absolutely critical to human health. So dietary fiber comes from plant-based food, so it's an indigestible carbohydrate. It doesn't get absorbed by the small intestine. It passes through the stomach and now without much change. But the health benefits are very extensive. So a lot of literature has shown that high dietary fiber intake has been reducing the chance of developing heart disease and type 2 diabetes, as well as it maintains healthy blood glucose levels. Why that is because the dietary fiber helps monitor the carbohydrates. The carbohydrate we spoke about brings the insulin levels up, and what we need the dietary fiber to bring that down to stabilize it for blood glucose management. So the next one, it actually reduces LDL, bad cholesterol, and increases HDL, good cholesterol. Regulates appetite and assists weight management because dietary fiber makes us feel full. When we have a lot of vegetables, we're going to feel very full. How that assists weight management, because dietary fiber has been shown improved appetite, which means that you're not going to be wanting to eat more. So it's a double bonus from that side. Also reduces the risk of diverticular disease, hemorrhoids, and bowel cancer. So some high dietary fiber foods include oats, psyllium husk, seeds, legumes, nuts, banana, and whole grain bread. So the Australian Government National Health and Medical Research Council aims for Australians to get approximately 30 to 35 grams of protein, of dietary fiber, for example. The next one is water, the last macronutrient. So water is absolutely critical. There's some really amazing studies that have shown that the human body is approximately 60% water. Brain and heart being 73%, lungs 83%, skin 64%, muscles and kidneys 79%, blood 90%, and bones 31%. So what does that mean? It means that we must absolutely critically have to have water every single day, approximately 2 to 2.5 litres. That's going to be dependent also on the individual, the weather, for example. So the key benefits, there's really too many to list. It'll be an essay, but some of them including lubricated joints, so we need the water to lubricate our joints. It forms saliva and mucus. It delivers oxygen throughout the body, so we have to have water in order for our oxygen to be pumped throughout the body efficiently and effectively. It maintains skin health, protects the brain and spinal cord, and it's also very important for exercise. Anyone would know when we don't drink enough, we get side effects. We get dry mouth, we get lethargy, we get headaches, we get migraines, potential fainting, or dizziness. So we have to make sure between 2 to 2.5 litres of water every single day. So now let's look at some common health challenges for the senior demographic and what do we do with evidence-based nutrition. So we're going to speak about weight management that came up today, osteoporosis, arthritis, pre-diabetes, type 2 diabetes, blood sugar dysregulation, and cognitive decline. So the first one is weight loss. Weight loss is something that's spoken about nearly every day by a lot of people, and there's a really, I actually put the full reference for this article, for this journal article, which was by these authors in 2018, which defined the optimal dietary approach for safe, effective, and sustainable weight loss in overweight and obese adults. It's very important to understand with weight loss, it has to be sustainable. We can understand there's two sort of categories. We have acute weight loss and sustainable weight loss. Acute weight loss will be something like The Biggest Loser TV show, where there's a drastic reduction in food consumption, calories, and a drastic increase in exercise. What are the side effects? It means that our metabolism is significantly reduced. Metabolism being very important for weight management because it's the effect of how the body burns energy from after we eat. Hunger goes through the roof. We have a large degree of muscle loss because the body is starved, the muscle in the body gets tapped into the muscle tissue, and what's been shown to always happen, rebound weight gain. So you'll have a large amount of weight loss if you cut your calories so much, cut your food so much, the exercise goes through the roof, but nearly 99.9%, if probably 100%, you're going to put the weight back on. So what's the key that I do with anyone that I see is we call sustainable weight loss. So sustainable long term. So it's slow, gradual reductions in food intake, and you have regular meals and snacks and consistent regular exercise. Not extreme. What the evidence have shown that there's absolutely zero side effects. If someone actually reduces their food, has healthy exercise levels, loses weight over a long period of time, they keep the weight off because the body is not under extreme stress. It's sort of primed for weight loss. So we need a caloric deficit in order for weight loss to be achieved, which meaning that we have our what's called we use it like a scale. We have the scale, which is meaning that if you have your base amount of calories that the body needs to maintain our weight versus the calories burned, there won't be a change. Things will be static. If we increase our food intake, it means that there's going to be weight gain if exercises stay the same. There's going to be a net weight loss if our calories consumed is less than what the body requires to maintain our body weight. So we need to make sure that we're in a what we call a net calorie deficit in order for weight loss, but must be small and gradual over time. So this would be sort of an example of a weight loss nutrition plan, 3-day example, where you can see you have breakfast, snack, lunch, snack, dinner, snack. So why that is that it's really important for regular meals for maintaining our blood sugar levels, and also really important to have small meals throughout the day instead of large amount of meals. So what are the key points? The key point is focusing on whole foods. So whole foods, fruit, vegetables, nuts, grains, seeds, legumes. These foods have the highest what we call nutrient density versus low caloric intake. So we have to make sure for a weight loss diet, we have what we call a high satiety dietary intake. High satiety makes us feel full, but not excess energy for what we call to spill over into weight gain. We've got foods that are high in micronutrients, vitamins, minerals. We have a balance of protein, carbohydrate, and dietary fat. And we also have foods that are high in dietary fiber to make us feel full. The first one, osteoporosis. So osteoporosis common in the senior demographic, and what we look for is some key nutrition interventions. So dietary intake as well as exercise to support the bone tissue. The dietary intake plays a critical role in bone health as it determines if the body is getting the macronutrients, protein, carbohydrate, dietary fat, dietary fiber, water, and micronutrients it needs for bone health and formation. So micronutrients, vitamins, minerals, phytochemicals are all essential for the human body. Less required amounts than in macronutrients, which require more higher amounts, but micronutrients are critical for human health, and it's very important for bone health and formation. So specifically protein, calcium, magnesium, vitamin D, vitamin K, phosphorus and manganese are the key nutrients for bone health. So whenever I'm working with someone who has osteoporosis, we must make sure we have these key nutrients, as that is going to be advantageous for osteoporosis. So the scientific literature supports an alkaline diet for the most appropriate dietary intervention for optimal bone health. So an alkaline diet can assist balance the ratios of vitamins and minerals that are crucial for building bones and retaining lean muscle mass, which include calcium, magnesium, and phosphate. So alkaline diets also improve creation of growth hormones and vitamin D absorption, which are both shielding of bones as aging progresses. So some foods that, for example, the key in those nutrients: kefir yogurt, bananas. We've got some green leafy vegetables and some brown rice. So these would be some options of someone who wants, with osteoporosis, that you need to make sure there'll be an alkaline diet, as well as the exercise example, which is going to be very important for assisting the bone. The next one, arthritis. So what are some medicinal nutrition interventions? So fatty fish would be number one. So someone who's got arthritis would be very beneficial to have fatty fish in the diet, such as salmon, mackerel, sardines, and trout. So in a randomized control trial, so when they do studies, whether it's in a laboratory or in a if it's outside or in wherever the study's being done, there's set parameters for that. The key parameter that I'm looking for as an evidence-based nutritionist is randomized control trials. What randomized control trials are is that they have two groups, and the groups don't know what the intervention is or what they're having, versus someone which is not randomized where they know what's going on. So these people that are in a randomized control trial do not know what dosage they're having, the food that they're having, they have no control over that. Only the authors or people that are doing the study do. So 33 participants were fed either fatty fish, lean fish, or lean meat 4 times each week. After 8 weeks, the fatty fish group had significantly decreased levels of specific compounds related to inflammation. Number 2 is garlic. So in one study, researchers analyzed the diets of over 1,000 arthritis patients. They found that those who ate more garlic had a reduced risk of hip osteoarthritis, likely thanks to garlic's strong anti-inflammatory properties, as well as that a specific component in garlic could decrease some of the inflammatory markers associated with that arthritis. We spoke earlier about inflammation, and with arthritis, we have to make sure that we're decreasing inflammation. So for example, fatty fish and garlic are high anti-inflammatory foods. The last one is ginger. So 2001 study assessed the effects of ginger in 261 patients with osteoarthritis of the knee. After 6 weeks, 63% of participants experienced improvements in knee pain, as well as another study also found that ginger and its components block the production of substances that promote inflammation in the body. So this would be 3 examples: fatty fish, garlic, and ginger, that would be very advantageous for someone with arthritis. This is what we call nutritional medicine at its best, where we can use food as medicine for the body, particularly in these conditions, without using pharmaceutical medications backed up by the literature. Pre-diabetes, type 2 diabetes, blood sugar dysregulation. I've sort of categorized that in the same category, which more comes down to the blood glucose dysregulation. So some medicinal foods, number 1 would be green leafy vegetables. So green leafy vegetables, everyone will think about, you gotta have more vegetables. Why is that? Vegetables have a low energy density, which means that they're low in energy, and a high satiety, which makes us feel fuller for longer, which is going to regulate our blood sugar levels. So whenever someone is having type 2 diabetes or blood sugar dysregulation, there's always an issue with their blood sugar levels. So we have to make sure that we're putting foods in the diet that are going to maintain our blood glucose levels. So some evidence suggests that people with diabetes have lower levels of vitamin C, and that people without diabetes, and that they have greater vitamin C requirements. So green leafy vegetables have a lot of vitamin C, so that's a perfect one for that. Increasing dietary intake of vitamin C rich foods can help people with diabetes increase their serum vitamin C levels while reducing inflammation and cellular damage. So green leafy vegetables is very important that we get a range of them: spinach, green leafy, any spinach, capsicum, and kale, those sort of things. Lettuce is also really important to have variety. The next one is avocado. So avocado consumption is also associated with improved diet quality and significantly lower body weight and body mass index. Eggs. So eggs may decrease inflammation, improve insulin sensitivity, increase your HDL, which is the good cholesterol levels, and modify the size and shape of your LDL, bad cholesterol levels. A 2019 study found that eating a high-fat, low-carb breakfast of eggs could help people with diabetes manage blood sugar levels throughout the day. So these would be 3 examples of foods that someone could implement when they have type 2 diabetes, and they will see beneficial changes with that. Next one, cognitive decline. So cognitive decline over time, aging, the cognition goes down. So what we want to do is have some nutritional interventions to make sure that that is supported. So number 1 would be broccoli. So broccoli is packed with powerful plant compounds, including antioxidants and are rich in vitamin K. So antioxidants we have in the body mainly from fruit and vegetables, and again it's the anti-inflammatory component that assists with that. Antioxidants is essential to have every day. Vitamin K is also essential for forming sphingolipids. It's a type of fat that's gently packed into the brain. So we need to make sure we have those lipids in the brain, and vitamin K is essential for that. A few studies in older adults have linked higher vitamin K intake to better memory and cognitive status. The next one would be pumpkin seeds. Pumpkin. So pumpkin seeds contain powerful antioxidants that protect the body and brain from free radical damage. That's damage to the brain, so we need those antioxidants in there. So pumpkin seeds are rich in zinc, which is crucial for nerve signaling in the brain, magnesium and copper. So low magnesium copper levels are linked to many neurological diseases. And iron. So iron deficiency is often characterized by brain fog and impaired brain function. So last but not least, nuts. So research has shown that eating nuts can improve heart health markers, and having a healthy heart is linked to having a healthy brain. A study found that regular consumption of nuts could be linked to a lower risk of cognitive decline in adults. And another 2014 study found that women who ate nuts regularly over the course of several years had a sharper memory compared with those who do not eat nuts. So, what I do, so my personalized nutrition consultation. So I've just come on board with Active Seekers as a clinical nutritionist, so very excited. So the first consultation will be an initial consultation. So number 1, that I believe that I'm not going to be working only with someone's nutrition. I'm going to be looking at them as a whole. So I'm going to be asking extensive questions of body systems, such as what's your digestive system, your hormonal, immune, skin, musculoskeletal, nervous, cardiovascular, because we need to make sure that all systems in the body are working optimally for optimal health. What we do is a dietary analysis, so we look at exactly what you're eating. I point out exactly what your macronutrient and your micronutrient profile is. We can see if there's any deficiencies, excesses, and I can recorrect that with diet. And also looking at your lifestyle, sleep, exercise, stress management. So I'm all about tracking results, so data determination is going to be dependent on anyone that I see. It's individualized, giving a DEXA scan, body weight measurements, waist-hip ratio measurements, food diary, blood test analysis, or digestive rating scale. And from that, I develop an extensive evidence-based treatment plan, and we set our goals together. So in clinic, it's $160, online is $140, and there is private health care rebate from that. From the list on the left, or everyone who has these private health funds can get rebate from nutrition consultation. So the next thing that I do is subsequent consultation. So once we have our initial consultation, you have your plan. We want to review, assess, and reassess initial treatment plan. So we're continuing to make progressions towards your health goals and ongoing nutrition education. So re-evaluation of data and evidence-based treatment plan. So in clinic, If you come here, it's $80, and online it's $70, and private hair care rebates. Thank you, guys. Any questions that you guys have? I'd love to answer anything and everything. Yes.
You talked about water.
Yes.
2.5
Water.
litres.
Yes, 2 to 2.5 liters.
What about tea and fruit juice? Is that included in that, or is that something separate?
That would be separate. So tea and fruit juices, we want to make sure that at least we have 2 to 2.5 liters of water before we take into consideration tea and also fruit juices. But you want to make sure that you're limiting your fruit juice intake, because when they do the juicing process, they strip the dietary fiber intake, so there's no dietary fiber in the fruit juice. So it'd be much better to have the whole fruit because you have the dietary fiber. Does that make sense? Does that clarify that?
And you never mentioned alcohol.
Yes.
Which is a
Separate topic. That could be that's a whole six
that
hour.
does relate to nutrition.
Yes.
You have to have alcohol.
Yes.
But it wasn't mentioned.
Yes, so the alcohol is alcohol is a drug. Unfortunately, people don't want to, that is what it is, it's a drug. But alcohol has been shown to do, chronic alcohol consumption has been shown to improve increased belly fat gain, decrease cognitive decline, as well as increase in the aging process. So wine, red wine, white wine has cardiovascular properties such as resveratrol, which is going to have cardiovascular health. But we just need to make sure that our alcohol intake is minimized because of those health consequences from that. So the Australian Dietary Guidelines limits the alcohol intake to 2 to 3 standard drinks. From an optimal health side of things, that would be minimized.
What about milk?
Milk. So milk, there's absolutely zero problem with milk unless someone has negative side effects from that. So if someone has a dairy allergy or lactose intolerant, if someone is not experiencing any bloating, flatulence, diarrhea, that side of thing, milk is absolutely fine unless there's an issue. Yes.
Where does fruit fit into the
Yes,
dietary?
so fruit would be mainly from the carbohydrates. So that would be an example. I didn't put that in, but fruit is from a carbohydrate-based source. But fruit would be a high-quality carbohydrate, and it's more very high vitamins and minerals in that as well. So fruit is essential. Fruit and vegetables are essential to have every single day. But that would be a very high-quality carbohydrate. Yes.
What about dried fruit?
Dried fruit is not beneficial in high amounts because, again, dried fruit strips away dietary fiber, and dietary fiber is essential in digestive health and also for the blood sugar dysregulation. So minimize that, increase whole foods, minimize dried foods. Yes?
Now, I noticed, I think the slide, in your protein one, you said beef was a low quality protein. I wasn't.
No, so I was talking about the processed meats.
Oh, corned beef, I
Corned
didn't see
beef,
that.
yeah,
So
yes.
lean meats.
Yes.
Yeah.
Yes.
Somehow I didn't see
No,
it.
so when you go
Yep,
to the
yep.
supermarket and you'll see the packaged
Yeah,
meats,
of course. Yeah.
they're very, very loaded. That's very not helpful for
Yes.
someone, particularly with blood pressure, because the way they make the meats, they're extremely high in sodium. And when
Yes.
someone has a huge sodium intake, it's going to escalate the blood
so
pressure levels.
Somehow I didn't see the corn.
That's okay. Yeah, so it's just the processed meats
Yeah.
that are the problem. Yes.
If one is on green leafy vegetables which
Yes.
are very strong, and
Yes.
you're on warfarin,
Yes.
is there a problem?
So with warfarin, it's always that with green leafy, where was the green leafy? Yeah, green leafy vegetables. So with warfarin and the blood clotting medications, it's always going to have on the instructions foods that you cannot have. I'm not exactly familiar with the exact foods, but with warfarin they will have specific foods, and then you just be able to alternate that with a healthier source if it's not green leafy vegetables. Makes sense? Yes.
Is there an advantage in alkaline water?
So there's a lot of studies in the sense of alkaline water versus normal water. I normally say to anyone, because someone's credit card is going to go through the roof if they're having alkaline water every single day, so I just say to stick to normal water and make sure that you have a high alkaline diet, which normally recommends that you don't need to specialize in alkaline water. There's nothing wrong with it. Anything else? Yes.
When you say a high alkaline diet,
Yep.
You listed kefir, but what else would you use in a
Yes,
high
it-
alkaline?
Yes, a high alkaline would just be, so when it comes to these nutrients, protein, calcium, magnesium, you're just having those foods that are high in those nutrients. For example, protein, calcium would be a lot of green leafy vegetables like we spoke about. Magnesium would be like banana, rolled oats. Vitamin D would be fatty fish. Vitamin K would be a lot from green leafy vegetables. Manganese would be from that as well.
So just plain yogurts, other than this one.
So yeah, the yogurts, there's all different types of yogurts, but what's really shown to be really good is the kefir yogurt, because the kefir yogurt has a greater amount of probiotics. Probiotics are really important for gut health. They feed the gut bacteria. So kefir would be sort of king in that sense, as the greater probiotic and also the increased calcium.
So what do we look for on the label?
So that's it. So just look at the kefir. So it says the kefir.
It could only be that brand.
No, any brand.
Oh.
Any brand. You just want to make sure it's from kefir.
Okay.
That would
So
be
K
K-E-F-I-R.
Oh.
K-E-F-I-R. So
Okay.
kefir.
Does it matter if you make your own kefir from milk?
Yeah,
Is that work the same?
it's working the same. So it
Okay.
depends, like for example, this brand Valia is a very sort of well known to have 40, as it says 14 active strains of the probiotics, but if you make it from your own, it's
Yeah.
perfectly good as well.
If people are quite a bit low on dairy products,
Yeah.
can they have yogurt?
So with the yogurt, you can get lactose-free yogurt, which is fine. But if you don't have lactose-free, that's going to be a problem for the dairy. You just want to make sure if there's any issue with dairy, you stick to lactose-free, which are available everywhere.
What is the kefir? What is it?
So kefir yogurt, so it's just yogurt, but it's a specific strain of yogurt that has a higher amount of probiotics. So when you get normal yogurt, it has a small amount of probiotics, but the kefir, what we call is turbocharged with those probiotics.
Kombucha is supposed to be that source of probiotics.
Yep, kombucha is fantastic as well. Kombucha, kimchi, sauerkraut, these are all foods that are really high in probiotics, which is really important for gut health. Any other questions?
What would you say about paleo?
Paleo? That's a very good question. So there's so many diets out there. Paleo, ketogenic, intermittent fasting, low fat, high fat, high protein. There's like 20, probably 100 of them. So paleo diet, so the thing that comes with specific diets is that you just have to be very careful. What I mean by that is that some people react to paleo diet. So paleo, is just protein and fat. Protein. So paleo means from paleo-based foods. So that's fine. Like that's really good. I think that's what the human body is meant for, to have whole foods, fruit, nuts, vegetables, grains. I just want to make sure to really reiterate today is that diet is very individualized, and some people react well to different diets and some people don't react well. So it's all very individualized. So for example, someone who does intermittent fasting, where they eat first thing in the morning and just wait till the night time, they react fantastically. The energy levels are through the roof. The hunger's in check. If I did that, I couldn't get out of bed because I just have to have regular meals throughout the day. So all diets have to be taken in context. So diet, you just want to make sure with any diet you're just having your macronutrients, you're having your micronutrients, and it's going to be workable for you.
What about the impact of Ozempic?
Sorry?
Ozempic,
Ozempic?
Yeah.
Never heard of Ozempic.
it's an injection.
Injection.
It's supposed to be helpful.
I'm not familiar with Ozempic, to be honest.
There's a controversy about vitamin K.
Vitamin K?
Yeah.
Is it Ozempic?
No.
Oh.
nothing to do with it.
Oh, no.
Vitamin K is controversial. Some people say it's good, some people say it's not very good.
No, I mean, all those, vitamin K is a micronutrient, so vitamin K is absolutely critical. So with all the vitamins and minerals, if there's a deficiency in any vitamin and mineral, there's going to be health consequences from that. So normally the whole foods diet recorrects that, but vitamin K is an essential vitamin to have. Yes,
Ozempic is actually a diabetes drug
diabetes drug.
to try and control type 2 diabetes.
Oh.
Will help with weight loss. It's not designed for that, and
No.
it has some bad side effects.
Yeah, so all those drugs, when you look at like a weight loss drug, that's a lot of marketing from pharmaceutical companies, but there's obviously side effects that go through that. So normally what I find, going back to the weight loss side of things, if there's just a sustainable approach, there doesn't need to be the requirement to have medications. So everything's done right. Anything else?
The water,
Oh, sorry, you go ahead and hold on afterwards.
Yeah.
the water, you said 2.5 litres.
2 to 2.5. That's what the
about
National Health and
8
Medical
glasses.
Research.
And you're saying that it has to be water, nothing else like tea or coffee or
So
anything else.
It's so that when they say that, so it's a recommendation 2 to 2.5. So again, it's going to be individualized, but that would be the most optimal side of things, because you've got to understand when someone's having a high tea intake, there's a caffeine, there's a diuretic component to that. So that's why water doesn't have that side effect from that. So that would be sort of beneficial. But normally when I work with someone who's having 2 glasses of water per day, you just gradually work your way up. You don't want to go from 0 to 100 because you'll be running to the bathroom 50 million times a day. So we just want to make sure that there's whenever you're trying to move your way up from something, 0 water, got 100 glasses, you just move your way up to gradually. Yes.
Also, if you have, like when you have low sodium,
Yeah.
sometimes water has to be reduced to.
Yeah, so that's again for the medical side of things.
Right.
So whenever they're doing, the National Health and Medical Research Council is giving recommendations, it's very important these are just recommendations. You always, if there's an underlying medical issue, sometimes you always have to consult the doctor. So that's it. That's with anything, any dietary intake, any recommendations have to be coordinated with the health professional.
Where do you fit exercise into all of this?
Everything. I'm the nutritionist. I leave Taylor to do the exercise side of things, but exercise and nutrition goes hand in hand. I do nutrition. I exercise every day, not every day, but like to. But exercise critical for all of these things. I mean, there's thousands of studies that have shown exercise to be critical for bone development, for general health, for mental health. Everything will know. If someone doesn't exercise, you'll know that you get side effects. You're more lethargic. You're weaker. That side of things. So exercise critical.
Good work, Jake. That's an important message.
Yeah. Please exercise.
Keep exercising.
Keep exercising for the rest of your life.
Don't stop
Don't stop exercising. Yes.
I just wanted to ask you about any views you might have about gluten intolerance.
Gluten intolerance. Okay, gluten is a big key word for this. There's a lot of, we call it the gluten world. So gluten, there's a lot of studies that have been shown. Some people, gluten is a problem if someone is intolerant or someone's allergic. If someone is not intolerant or allergic, there isn't going to be gluten issues unless there's an underlying condition. So someone who has side effects from gluten will experience the gastrointestinal side of things, but when I'm working with anyone, I don't want to be limiting foods if there's not a necessity for that. Because a lot of gluten foods are very rich in vitamins and minerals. So there's only a need to eradicate a food from someone's diet if there's an underlying condition that requires that. Anything else?
We didn't really talk about gaining weight.
Yes, gaining weight. So gaining weight is a separate topic, but one that's very important. So gaining weight, when we talk about weight loss having to be in a net caloric deficit, gaining weight need to be in a net caloric surplus. So you can either achieve that by increasing, so primarily from increasing your energy intake, your dietary intake. So how that works is that we just need to make sure that the amount of food that we need to maintain, we have to be on the higher side of that. So we need to increase in those foods to get the weight muscle tissue up.
And have you booked into you? Have you booked into?
Yeah, so we can talk about it afterwards, but I've got a calendar that I can do, and we're just booking times when would work best, either coming in here or we can do online.
Thank you.
Anything else?
Very good. Yeah. Thank you.
Thank you.
Let's give a round of applause. Went through a lot of information there, folks. So, so if anyone is interested in organising time with Jake, and the
Yeah,
office,
yeah,
and the
yeah.
office is available for you.
Fantastic.
But yeah, I think I hope you've all enjoyed today and got something from it. At least one thing you can take away from today and put in place. And yeah, I will ask the set of people if they want to. We can just head to the front reception area while we just get the exercise equipment set up there. And